Good day, everyone, and welcome to today's Cutting the Ties to Paper web seminar presented by SDS and Formfast. For opening remarks and introductions, I'd like to turn the call over to your host, Mr. Aaron Brandwood. Please go ahead, sir.
Thank you. Welcome, everyone, to Cutting the Tie to Paper. I want to thank everyone for taking time out of their busy schedules to hearing some of the areas that we'll be addressing on cutting the ties to paper in your facilities through the forms management and the EDMS, or the electronic document management system. In conjunction with one another, we really feel this will help relieve the burden put on all of us by the paper records. The presenters with me today will, of course, include myself, Bill Dole, and Sean Curtis. My name is Aaron Brandwood. Again, I'm a Vice President of the SDS EDMS product line, which is called HealthPort. Bill Dole is the Director of Business Development for Formfast, and Sean Curtis is also with us. He is the Product Marketing Manager for Formfast. So I'm sure you've all seen pictures like this, or maybe it's very similar to what your records room looks like today, or you've been in facilities where you can sympathize with these medical records departments. The addiction we have in healthcare to paper can cause a number of issues, as many of you know. This paper consumption comes from various areas across the enterprise, different departments, and sometimes, clinics that lie outside our current facilities. A lot of the typical paper generators come from a number of areas. Two of the places where the paper addiction commonly starts is registration in forms and through the use of the paper forms. It is in these two areas that we will concentrate today to supply some thoughts on how to cut this tie to paper. Some of the areas of concern as we see it, the registration process, if not performed properly, can create a vast amount of paper for your facility. Being the typical starting point for patient encounters, this is an ideal place to start cutting the paper addiction. And the forms go hand in hand with the registration process as we see it when it comes to the paper addiction. If proper forms management tools and processes are not in place, registration will never truly make a break from the paper creation. Typically, there are stacks of pre-printed forms that are pulled and completed for each individual patient. If you're trying to cut the tie to paper, this is literally the birthplace of the paper trail.
And Aaron, this is Bill. I'd like to interject one thing here. Sometimes it's difficult to determine what a hospital is spending on pre-printed forms. So kind of a general rule of thumb is that pre-printed forms cost an average of about $1,000 per bed per year. This is a number that has been used by the vendors of pre-printed forms for some time now, and it appears to be a fairly reasonable guide and measurement for today.
Good point, Bill. So, I think to wrap up this slide, not only are these paper records choking process improvements, but they're also the source of what can become a rather large expense to the facility, as Bill mentioned. So what's at risk? What are we talking about? We wanted to share a few more statistics from Cap Ventures and PricewaterhouseCoopers research and what paper is costing your facility. Keep in mind, this is just in the areas we are discussing today, the forms management piece.
And Aaron, another important statistic on this slide is the top item that talks about a 15 to 25% of forms being lost to obsolescence. As you discussed on a previous slide, hospitals spend a lot of money on pre-printed forms. So when you lose 15 to 25% of your forms to obsolescence, this can represent a significant dollar loss. Even a potential worse situation is an organization using forms that have become obsolete. This leads to potentially legal issues. It can cause billing and charge capture errors, and certainly can extend the revenue cycle.
Right. I think through the statistics supplied on this screen here, you can see really that the forms management piece can really be costly for your facility. And it's for these reasons that it's important we at least begin to cut the tie of paper through the forms management process. So where do we start? The first thing you need to do in order to implement proper forms management is each facility, it might be your main facility or facilities throughout your organization, needs to really start with the form standards regarding form templates. Standardization of these templates, will help you with efficiency since providers can quickly find information they need on documents. A consistent presentation of information will also allow for proper gains in efficiency throughout your facility. The second area we feel like is you will want captured for each patient in a barcode. So applying barcode forms is more than simply slapping a barcode image onto a document. It requires that you consider what information is required to properly identify a patient, document, or form. This information needs to be what is captured and presented by the barcodes on your documents. So discussions and decisions in your facility need to take place regarding when review will take place of digitally created forms in the future to ensure that they are up to date. Conversion of current forms and the creation of said forms into digital format will also need to be discussed. In the next couple slides, we will show you what options are available for converting forms in any format over to a digital version that can easily be managed in one central repository. So we'll kind of go into that. But I think to kind of summarize that is a really big part of that is the forms that will still need to be printed. We really want to standardize and get a barcode applied to those forms. And doing that, that will allow us to really cut down the assembly of those charts as they come in, because a form that has a barcode, patient identifier, and a form on it simply just needs to be scanned in, and a properly formatted EDMS should be able to recognize that form and put it in proper context in your system. Step 2, on the cutting addiction, after reviewing your current form situation and determining the standards you will follow as an organization, it is then time to pull together actual users of your forms to review decisions that have been made and to make sure that the goals set forth by your organization are in line with all the departments, and then, of course, through administration to make sure everybody's on the same page.
And I think, Aaron, two of the most important words on that slide are, for a hospital to define success. As a hospital starts to develop a roadmap to move from paper form to digital, it's critical that as a group they determine what will be the ultimate goal and what success will ultimately look like. Success for one facility may be to arrive at a point in forms management where only a small percentage of their forms are still being printed to be filled out, whereas success for another organization may be to have 90 to even 100% of their forms being completed and accessed electronically with as little printing as possible.
Right. So step 3, after you have all the planning in place, the goals have been set, and the proper cooks have been invited to the kitchen, so to speak, you will need to know what options you have at your fingertips to make the successful move to digital forms management. One key bit of information to note is that in the forms management industry, you don't have to stick with one vendor based on a previous purchase you have made. Your purchase of specific EMR, EDMS, or even registration products makes no difference in electronic forms management. The form tools available typically address 4 major areas. You have form design and data mapping, forms on demand, which is printing or accessing only needed forms, a repository to manage all forms, and workflow for forms routing. So what tools do I need? With each of these 4 tools, it is important for you to know the specifics of what is provided to you to determine what your organization will need. Design, importing, and data mapping tools are the basic building blocks for any forms management purchase. These are the tools that will allow you to capture paper forms and electronic forms into a single location for storage and editing. If you're planning on cutting the tie of paper through forms, this is a critical piece that must be a part of your facility's planning.
And Aaron, it's also important to note at this point that advanced forms automation offerings like Formfast allows the hospital to map and merge data from their HIS, EMR, or registration system directly onto the forms. That means that when the forms are printed, critical predetermined patient data will already be merged onto the forms as they print.
That's right. That's a great lead-in to the on-demand tools, Bill. You mentioned printing the forms out, and I know that may be confusing to some since we are discussing cutting the tie to paper. Let me explain a little bit what we're talking about. The on-demand tools are in place to help keep the printing of forms to a bare minimum once you have all of them in a digital format. It's the pre-printing of forms and the lack of barcode usage that makes our addiction to paper in these areas so strong. The on-demand tool allows end users to select specific forms that they need to print on demand. This virtually eliminates the use of obsolete pre-printed forms within your organization. And as Bill mentioned in that previous slide, that's where a big cost savings comes from, is the elimination of the obsolete forms, obsolete pre-printed forms within your facility. To help keep forms from becoming obsolete in the forms management system, you want to look at forms repository functionality. Basically, this is a centralized location to make changes and manage all your forms to ensure that they are not becoming obsolete. Versioning of forms, release control, and entitlements are all in place to help ensure your entire forms library is managed correctly. A final piece that is available from some form vendors is that of workflow. Workflow plays a critical role properly utilizing all the form tools we have just discussed. Through proper workflow at different stages in the patient care process, only the predetermined needed forms are sent to the specific departments or users for completion. This bit of functionality helps complete the elimination of any pre-printed forms at any time. And then, of course, workflow also allows data you have in a cold format that is typically presented in a document management system with no formatting to now be placed automatically onto a form to help keep consistency when presenting documents in an EDMS type product. And what I mean by cold is the ability to bring over a electronic print stream. So if you're printing a lab now, the ability to electronically grab that document without printing it and then formatting that information contained in that print stream to make it look like you want it to look in the EDMS. So the ultimate goal here, as you see in the graphic, you have to ask, your facility or your forms management committee, what is our ultimate goal? Well, the ultimate goal is to take out yet another area of addiction to paper. As you can see in the graphic we have discussed today, is how to get your organization to this operating environment. We want to create a central area to manage all your forms in a digital format. We want to provide users on-demand access to said forms, and we also want to provide a way for digitally completed forms to be sent directly to our electronic document management system to eliminate printing altogether. So you can see how this streamlined approach for your facility can really eliminate the forms. So starting with paper forms and electronic forms, and as it moves through the high-level graphical overlay here, you're seeing, appropriate forms, printed in nursing. And then I talked about cold on the last slide. If we're grabbing a lab transcription or radiology and managing that through the forms management piece, all three of these steps are eliminated, and that form is simply sent all the way down here and then resides in the EDMS. So you have eliminated 2 steps there, and that information is now immediately available within the EDMS. Some of the benefits that we see, we want to put these type of solutions in place, to drop our forms costs, eliminate forms obsolescence, and eliminate the need for paper-based products such as blue cards, imprinters, and embossers that we see a lot of facilities still using today.
Yeah, and in our history here at Formfast, we have seen some clients have 90 to 100% of their clinical forms online in electronic format. And while we share this information with those on the call today, that they can expect a significant reduction in their form costs, it's important to note that basically the hospitals control their own destiny. With the tools provided by Formfast, the hospital can control what forms they bring to electronic format and what the time period is to accomplish this. So you don't have to have a big bang approach where you've got to bring everything on the day you put a product like this into operation, but you control it and bring them online when it's convenient and when it's appropriate for the various departments that you're working in. We'll just take the last few minutes before we open it up to questions to show you what SDS and Formfast offer along the lines of forms management solutions. All of the functionality Aaron discussed earlier is provided in these offerings.
So forms design and conversion, I think one of the most powerful offerings of Formfast. As we mentioned earlier, it is critical to bring your existing paper forms into your management system for a full digital forms management system. Our offering allows you to simply scan in your paper forms, and through optical character recognition technology, you have a form that can quickly be edited and used in a digital format. So, and I'll show you here later in a slide, we can create forms from scratch, but being able to scan in your existing form and then really, change and edit it really saves a lot of time and a lot of effort in really getting your facility to that goal, 50 to 100%, whatever your goal might be, to having a complete electronic forms management system. So a scanned and editable form, as you see here, this is an admission form that was brought in. We OCR'd it, and you can see it is a far more efficient way to bring your paper forms into the digital world than having to build from scratch each form. So that's very quickly done here. As you can see, it's scanned in, and each one of these are automatically made, patient last name, patient address. All those become fields that are filled in when it's printed out. So it's a very easy transition to get a facility to a complete electronic state. As I mentioned just a minute ago, if the need arises to create a form from scratch, we provide that functionality as well. So this is an example of an interface that allows you to create a form from a blank page. So drag and drop data mapping, as we mentioned several times on these slides. Once a form is set up, the next step is to map that data to where you want it to print on the form. This is accomplished through a simple drag and drop technique as shown on the slide. The step is done once for each form and then will automatically be repeated whenever the form is printed out in the future. And then for documents coming into the EDMS product from disparate systems through the cold or ERM feed, they are, as you all know, not exactly pretty documents. So setting up where your cold or ERM data maps on a form is as simple as dragging and dropping to the appropriate location. So you can see in the example here, we have a not so pretty, text document or what might be printed out. We can simply then, as it shows here, drag and drop that information to the appropriate form that we've created, and now we have a very easily legible form. The information is presented in a hospital number, medical record number, in a very easy to read form. And as I mentioned earlier, the providers really like this, the clinicians, in looking at these forms, not only online, but then those forms are printed out. So we talked about, once mapped, the data that is being presented from the cold or ERM feed now is much more user-friendly and familiar appearance. So I talked about the data mapping. Now once all that's mapped over, and we do that one time to this form, then all that information is then presented in a very legible, easy to use. So if I go back to that one graphic where we skipped the processing forms piece and it's sent right to the EDMS, we've made that form immediately available. But if we do need to print it out, as it shows up here on the admission form, we have the patient demographics and the form barcode. So if this comes into your department as a loose sheet, there is no prepping, paging of the document. You simply put it in the printer and scan it. It goes right into the patient's chart, electronic chart, and right in context to the admission form. So there is no having to scan into context or any of that. We've completely streamlined that process. It's brought over via cold or ERM, or if you do print it, there's still no manual data entry or manipulation of that document in the electronic state. It's simply put into the EDMS in the proper location. This is an example, with a centralized area to manage your forms, barcodes can now be easily placed on all documents, as I mentioned, so that when the forms are printed and completed by staff, they can easily be scanned, automatically indexed down to the document type level, and immediately available for patient care. So those days of all of those, loose sheets coming in and the burdensome of having 2 or 3 FTEs, drop file loose sheets is over. That information is simply put into the scanner and sent to the EDMS automatically. So the form imprinter we talked about. When documents are requested by staff for printing, the Forms Imprint module allows you to quickly determine what documents or packets are needed for a particular patient. Then the said forms are printed with specific patient barcodes and demographic information to streamline the capture of the completed forms. Excuse me. So you can see up here in this example the admit, the operative consent, Dr. Johnson's orders, and we have Peter Hannigan there highlighted. Then you go down to print, then all those forms are going to be printed, and they might be printed to one printer, or they might be printed to printers throughout the facility. So a lot of flexibility in having all of those forms electronic in one place. So with that last slide there on the kind of centralized the form imprinter where we had that, I'm going to open it up, open the lines up for questions now. We had one come through a little bit more detail on how the forms and the EDMS go hand in hand, and I wanted to go back to the graphical overview slide and talk about that just a minute from that question. So in this particular example here, this graphical overlay of how forms management here and the electronic document management system go hand in hand, the paper forms are either, they come in paper forms, we scan with the OCR as I talked about, or the electronic form comes in and import forms, and then each one of these steps, so it's either going through the forms management tool, and a barcode is being applied, and data mapping is being entered right here. And once that's done and managed here, and typically it's done one time, then after that it's streamlined, then appropriate forms printed in nursing, you can see these 3 bullets here, or as I mentioned in a cold, it's now being sent to the EDMS where it's automatically indexed and organized by the patient counter or document type. So that's kind of how we feel like starting with registration and then having a forms management and the EDMS really helps streamline that process. Okay. Next question. Do you have a workflow product? The answer is yes. Through the forms management tool and through the EDMS, depending upon what workflow is needing to be initiated or built. So in the forms management piece, Bill can talk about that, but on the EDMS side, we can trigger on document type, form type, the whole deficiency management piece. So if we get a document that comes in that needs a signature, we can flag that and build a whole deficiency queue, and then I'll let Bill mention the workflow that's built into the forms management Formfast.
Right. On the form side, we have a full, complete workflow solution for forms so that they can either be printed or they can be done online, and they include everything from routing forms to various people within an organization, within a group, full editing capabilities, full form fill capability, approval, routing, and all the workflow functionality with ultimately the final step of the workflow, putting the document into the EDMS solution when it's completed.
Right. So, we feel like, a lot of facilities have different components of what we've talked about today, but we really feel like having both the forms management software and forms repository and the EDMS is really, your biggest bang for the buck as far as, being able to cut your tie to paper and to getting your facility as close to, near paperless as possible. We really feel like having both of these products installed, and properly implemented and staged in your facility can really help your facility get to that point of paperless or near paperless. So the next question, do you support digital signature? Yes. On the EDMS side, we support complete electronic signature. So documents can be flagged and electronically signed, and through the use of workflow, the routing, the efficiency management, we have a complete use of the digital signature. And then, Bill, you want to talk about yours on your side?
Right. On the forms management side, we support typically eSignature at registration, where a couple ways that is done. One way is through what is called a ClipGem Topaz device, where form would be printed like a consent form through Formfast. It's put on the device. The patient signs the paper document, and that is their legal copy that they take with them. The electronic version of that form, along with the electronic signature, is then automatically passed to the document imaging system for storage. If a hospital chooses to go totally paperless and does not want even a piece of paper for the patient to sign, we do support the little pads like you'll see in Home Depot or Walmart, where they would read something on a screen or on a laminated sheet like the consent form. Then they would sign the little signature pad, and so in that case, the patient isn't walking away with a piece of paper, but they have signed, the fact that they did read and acknowledge seeing the document.
Right. Okay, I got another question come here. It says, the optical character recognition technology that you talked about that brings in paper forms, is that a piece you see as a typical offering in the industry, in other forms management? Bill, I'll let you take that.
Well, the scanning of forms into electronic format is offered in the industry. However, what we feel is that by providing the OCR capability to the scanning side so that the form can be edited, allows you to make the changes you need to make to documents or forms over a period of time. So when you scan it in, some products bring the document in as a static document, and you really can't change it. So the advantage of our products in doing it with OCR is that you can change it, whether you need to change it right when you scan it, or let's say a change happens a year from now, and you need to make a change to the form. Well, because it's in electronic and editable format, you can go in and make any necessary change, and as soon as you make that change, that document is online with those changes in place. So you've always got the current version of the form because the changes are made immediately.
Okay. And then next question, can you set up the forms in the order or group you want? And I think that probably goes to, let me get over here to the slide, proper slide. I think here, Bill, I think the question is talking about, can you set up the forms in order or group you want? And I'll let
Yeah.
you that. I think the answer is yes there.
Yeah, and just two quick examples. In the admissions process, for example, the hospital determines which forms are to be printed during admission, and then there's also some logic built into Formfast. So that, for example, if in the ADT process you're admitting a patient and you enter the patient's date of birth, for example, and calculates that the patient is a minor, well, Formfast has the intelligence to know to print the parental consent form along with all the normal admission documents. Or it can look at financial class and know which forms to print. So there's some intelligence built into it to determine what forms print. On the screen that you've got up now, Aaron, which is print on demand, this forms on the left-hand side is totally customized by the user, the hospital, so that the forms that appear there can be for every patient in the hospital. There could just be the forms for a particular unit, like if it's a cardiac wing or the orthopedic group. Then you can customize it so not only do just the patients who are on that wing or floor appear, but then just the forms that would apply to that particular department.
We do have a phone question.
Okay.
Please go ahead, caller. Your line is open.
This is Kenneth. My question is following up the one on viewing the forms after they've been entered into the system. Can you view them in any particular order in your hospital system?
Yes. Are you asking like through the EDMS once they've been formed or once they've been filled out and then entered into your EDMS?
Yes, we currently scan our forms into our system, and then they come up into our hospital system. And one of the problems that we have is they're not quite set up in the order or way that our staff is accustomed to viewing them. How adjustable is that with this system?
It's completely custom to how you want to view the form. So let's say you have 50 tabs in your chart and you want to mimic that view to make it a very easy transition for your providers or clinicians. That is completely customized by you. You tell us how you want to view that, and then that's how you would view the chart.
Can you set up different views for different groups?
You bet. Absolutely.
For example, the nurses would see a certain group of forms, and the coders would see yet a different view of forms?
You bet, yeah. And that's getting very not in depth, but getting into our EDMS product, and we would be happy to show you our HealthPort product, which is kind of some of the things that you're asking for is accomplished through the EDMS after the forms management tool. So we'd be happy to get with you and kind of show you, a high-level overview and take you through our EDMS and kind of continue that conversation. But yes, it can all be accomplished just as you said through the EDMS.
Okay, that would be helpful because different groups want to see different forms in our facility.
Right, you bet. And that's typically what we see in the EDMS, and that's why it's very role or group-based. So, physicians, for the most part, kind of have their view. Nursing wants to see a certain document set, and then that's completely built by you and the system administrator at your facility.
Thank you.
You bet. Another question, has this been used in Meditech hospitals? On the EDMS side, our primary install base is in Meditech hospitals, and then I'll let Bill answer that on your side.
Yes, Formfast is installed in over 200 Meditech hospitals. We are the business partner of Meditech, and so the answer is absolutely.
We have another question here. Have you installed this with Cerner applications? The EDMS HealthPort is installed with Cerner, and we've worked pretty closely with the Cerner applications as far as the HealthPort goes. And then, Bill, I'll let you take that on your side.
Yes, we do have Cerner implementations. We're not a formal business partner of Cerner like we are with a lot of the other HIS vendors, but basically we work with Formfast works with every HIS system, that's out there.
And I think, we mentioned that in there, the EDMS and the forms piece, very flexible as far as working with other ancillary systems, working with different EMR, EHR vendors. It is a very open type architecture, both products built to work in hybrid environments, and built to streamline the hybrid environment, through the forms management and the document management piece through the EDMS. Thank you everyone for your time today. We appreciate it. We hope this presentation has been informative and has started the wheels turning in your facility, trying to move you closer to that paper environment. We're all trying to get to that paperless or paper-light. There's many different terms associated with that. But really streamlining the forms management and document management through the partnership and working together with those two products, we really feel and have experienced that in many facilities, how impactful that can be to, as Bill mentioned, 100% of their forms online, to completely scanning all documentation through the use of forms into the EDMS, where there's one central repository not only for the forms, but now there's one central repository for all documentation. We really feel like can impact not only patient care, but also impact your facility on the revenue cycle piece, through coding, and then through the reduction of your AR days, as we've seen in many facilities. So again, thank you everyone for coming, and if you would like further information or to be contacted to talk a little bit further with us, we would be happy to visit with each one of you individually and do another WebEx or come on site and do a site visit. So everyone have a good afternoon, and we really appreciate your time on the call today.
This concludes today's conference. Thank you for your participation, and have a great day.